Hi guys, so this is Dr. Banerjee. Everybody calls me Dr. B. I'm actually talking today about, again, a very common topic I get asked by my patients. It's called melasma. So a lot of us women, most commonly, get to experience this fantastic thing called melasma. Most commonly it comes after any hormonal changes, so like pregnancy, childbirth, menopause, or even simply just due to the sun exposure. Melasma, what is melasma? So melasma is a hyperpigmentation of our skin. It could be any layer of the deeper or superficial layer of our skin, and it is a pretty nuisance, I might want to say. It's chronic, so it just doesn't really truly ever goes away because it's kind of in your genetics, and it is a recurrent condition. So even if we can make it go away, the pigments I mean, it will likely keep coming back, or at least want to try keep coming back. So what are the common features of a melasma versus something else? I mean, typically women are pretty good in identifying that, oh, I had a pregnancy and childbirth, and since then I have this patch of pigment on my face or part of our body. Most commonly, that is cumbersome if it's on our face, obviously, but it can be really any part of our body, and it is something where it doesn't go away with any amount of exfoliation. And if you have any amount of sun exposure, either no SPF or inadequate SPF, or just non-timely, no reapplication kind of situation, then it just keeps coming back. So what can we do about that? So I mean, can't really do anything about your genetics, so forget about that part. We can control it. Definitely, we have come a long way from saying that, too bad, so sad kind of situation. So we have lots of things we can do nowadays. So some of the treatments most commonly are used at home, because hopefully you're doing a good skincare routine every day, and then 80% of your skincare is really done at home, so that is quite crucial. And then there are some in office or in clinic treatments that we recommend in between to kind of give you that boost in your treatment success rate. So speaking of home treatment, so the most common one I would say, starting from would be sunscreen. Okay, well, I mean, I cannot re-emphasize enough, sunscreen is very crucial. So not just during summertime, guys and girls, winter is really important. And actually I think winter is worse because technically the sun is closer to Earth, so think about that. You do want to apply sunscreen every single day, even if you don't leave your house and you're not going for a drive. If you have windows in your house, UV rays are coming through, so you do need a sunscreen. So that's number one. Number two, now either you reapply sunscreen every couple of hours, which is kind of like a hassle, I'm not gonna lie. I mean, I personally am a very lazy person, so I would not want to do that if there was a way around. However, I would say if you are, let's say, staying in your office, going for your work, and you're not really sunbathing or sitting on a beach, you could probably get away without having to reapply that many times, and could layer vitamin C, 10% vitamin C serum underneath your SPF to just make it 8 to 10 times stronger. And that will be really crucial too, because as I said, sunscreen, sun protection is the key. And then in those vitamin C serums, we could either get some pigment removing treatment, so resorcinol, arbutin, or hydroquinone in certain cases can help. And then the other thing we can do is just a prescription hydroquinone. Now, there is a catch with the hydroquinone. So hydroquinone is a medication, as you can think, and it doesn't really come without any side effect. It does come with quite a few side effects, so it's not for everybody, bottom line. So if you are pregnant or trying to conceive, or you're breastfeeding, I would not ever prescribe you that. And if you are having any previous history of any cancers, or you're already on any cancer treatment in the past, or you're on any other immunosuppressive therapy, then again, you're not a good candidate for that, just for safety reason. And the third category is obviously there is a chance of what we call paradoxical hyperpigmentation. So unfortunately, there's no way of predicting it, and some people will actually make more pigment in reaction to that instead of reduction of the pigment. That's the whole reason we would ever prescribe you that. So it's kind of gray zone. Who can or cannot get that. So I would say talk to your physician, and they can go over your medication, your medical history, and decide if you are a right candidate for that. But I would say we actually have better, topicals, active ingredients, or energy devices available than just kind of leaning towards the hydroquinone nowadays. The other major one is retinol. I mean, our good old retinol. Very misunderstood. So if you wanted to know more about retinol and the ABCs, check out my other video. It will be uploaded shortly as well. But the retinol actually really helps in so many other things, including your pigment. So if your skin can get used to using the retinol, that's like a best thing ever. How often to use and how much, I mean, depends on your skin, but typical use, I would say minimum once or twice a week to get started would be good. And again, there is some ideas of you should just use it all the time, some ideas of spot treatments. So I will be answering some of those typical questions in my other video here. The energy-based devices at clinic, they are really a good option for getting that oomph out of the treatment. So it kind of gets things going, and it kind of gives you a really boost on your results. So if you're like, well, I'm kind of having this pigment for like ever, like 10 years, 20 years, I mean, what do I do now? Well, home treatments are definitely going to be advised, but it is also advised that you do try some energy devices to get started, because they need to clean out what is in there, and then the home-based treatments are going to still keep working on removing some pigments, prevent new pigments from happening. But energy-based devices are really great from that perspective, because they can do like work for 1,000 retinol days, probably in one treatment. So speaking of which, I'm just going to show you this. So this is our PicoSure Pro device by Cynosure. So what do we use this for? So pigments are our most common cause for using a PicoSure Pro. Now, this is a very unique device. This actually is a class 4 laser. However, this is not a device that uses heat for removing your pigment, so it's very, very safe. So how does it remove the pigment? So it actually uses a laser, which is one wavelength of light. When it touches your skin, it actually is making acoustic waves, which is sound waves. The waves are mechanically breaking down your pigment, and then your lymphatics are cleaning it out. So pretty cool, huh? I know. So no heat, related hyperpigmentation or other side effects that typically for darker skin type people like myself you usually have to worry about. And then also if you are worried about heat related side effects, so any burns or blisters, I mean pretty much non-existent risk. The other safe part for this device is actually there has been clinical studies proven that it actually can do some skin rejuvenation as well. So the same sound waves that can actually trigger a regenerative mechanism in your deeper skin layer, and that has been proven beneficial in basically turning that water wheel back again. So pigment removal, so melasma, we were starting to talk about melasma, right? Don't lose focus. I mean, I think I was forgetting. But Melasma. So melasma treatments would be tricky because, as I said, remember that chronic, recurrent. So if it's a chronic and recurrent, you might need a bit more than just once a year treatment. So you might need a every 3-month treatment to keep removing the existing pigments or the new ones, especially come summertime when people are out and about a lot more. You might just keep making new pigments a lot more than usual. So to get rid of those, it might be worth it to just get it once every 3 or once every 4 months. So in Dr. Beautiful Aesthetic, we actually have a special pricing for melasma maintenance facials. So that is highly, highly recommended in between your home treatments. And we also have another cool option to do in clinic treatment. It's called chemical peels. So what are chemical peels? The chemical peels are basically hardcore exfoliators made for your skin type and condition and concern. And we are going to use it in our office. Typically, we would do it once a month or once every 3 months, depending on, again, what we need. But for melasma, we will typically say once every 3 months, kind of in between your energy device treatments. Why important? Because we are going to reduce the dead skin layer, and that also reduces some of that pigmentation with those active ingredients. So in a nutshell, at home, you definitely need some ongoing maintenance treatments, and you got to be pretty consistent with your sunscreen. Vitamin C is, I personally use it every day. I just think it's everybody needs vitamin C. What kind of vitamin C depends. I mean, you can never go wrong with just a basic 10% vitamin C. If you don't know where to begin, go pick a pharmaceutical grade brand. Our own Canadian Vivier Skin is really good. Zeo Skincare also makes really amazing vitamin C, but my point is get a vitamin C. The cosmetic brands may or may not have 10%, so 10% is quite crucial because that is really the therapeutic dose. And then you want to also incorporate some retinol in your home treatments. And then if you are curious about how the treatments in office or at home works more, or perhaps you have gone through some treatments and you're just looking for that maintenance facial, send me a direct message, or you can email us, or you can text us, you can call us and leave a voice message, whatever works for you. I'm more than happy to answer that. And then if you ever wanted to book a consultation, just know that that is at no cost, because information should be really free, and I'm happy to go over the consultation and discuss your concerns with you. Okay, until next time.